We continue with reaction on the alcohol ban during lockdown. Now, the ban comes following a surge in alcohol-related trauma cases experienced at hospitals since alcohol sales were reintroduced under relaxed Level 3 regulations at the beginning of last month. South African Medical Association chairperson Dr. Angelique Coetzee says the ban will not solve the underlying societal challenges. She joins me now for more discussion on this. Dr. Coetzee, thank you so much for your time. Now, you're raising two areas of concern here, the other being 100% loading of taxis. Now, let's focus specifically on the alcohol ban, which was supported, by the way, by the Health Minister. Why do you think this is an irrational decision?
Good afternoon. SAMA is not thinking that it's irrational to have an alcohol ban again, because the misuse and abuse of alcohol currently again led to an increase in casualty related trauma cases and hospital admissions, which in a system that's already having a very heavy burden of COVID-19 and other sick diseases and patients coming into those facilities to cope and deal with them. On top of it, you also now have alcohol-related or alcohol misuse and abuse-related cases of violence or motor car accidents coming in. The problem is we can bring the ban back, and in August, are we going to lift it again, or are we now going to have a ban for the next year or so while we are struggling with COVID? So in that case, we are saying, yes, it is the correct thing. We have to have the ban. But the primary problem of why we have a country with a very huge abuse of alcohol and also domestic violence, with even in normal times. Why do we have it? What is the problem? Why is that not addressed? What are we going to do to fix the primary problem? Currently, I call it a plaster that we are putting onto a wound that is festering under the plaster. So when are we going to address the primary reasons for why this is happening?
Now, we know on the one hand, and as you've also alluded, that hospitals are inundated, especially as we are going to this peak period of COVID-19. Now, you've mentioned a better plan is needed. What is this likely to look like if government had to entertain some of the calls that say a ban of alcohol is not necessary, a ban of cigarettes is not necessary? What is likely to be proposed by yourselves to government in terms of this better plan?
Okay, it would be a better idea to look at the alcohol content or the blood alcohol content levels and maybe lower that. If you can lower that, even if you lower it to zero, forcing then people who drink at another place to use then Uber or any other mode of transport, except that they themselves are driving back home, that would most probably reduce the motor car or motor vehicle accidents due to drunken drive. That's the first thing, but I think that is something that's extremely important that needs to be looked at instead of just giving a blanket no alcohol sale. Then also you have to look at areas where there's high violence related to alcohol misuse or abuse, high, again, motor vehicle accidents, and then put a lockdown on those areas. And areas where there's virtually no problem related to the use of alcohol, look at the different system there. Give them something to say, thank you, we are noticing that you are doing this responsible, and therefore we can allow you to look at the different hours of buying alcohol. But just to come in and say everyone needs to stop alcohol. And remember, SAMA is not for alcohol. Please don't get us wrong. It's not. It's about the principle. It's about how can we fix a problem, but that's part of the problem to bring in current emergency measurements. We're coming back to the same problem. Once this is lifted, we still have not dealt with all the socio-economical and social behaviors and reasons why our country, a country of people who abuse alcohol, then have a lot of angry people that once if they are drinking alcohol, they become angry, and violence. Why? Why is that happening? What are we going to do?
Now, some would argue, Dr. Coetzee, that we are in the middle of a pandemic, and so what you are proposing could probably work in parallel to what government is proposing. And some would say that you can have two parallel systems where outlets are closed, alcohol is banned, but then have these long-term plans that you speak of be implemented. But who would be best placed to run with that? Given that there are so many people currently dealing with this pandemic?
Okay, first of all, this is not a new thing. Our country is one of the highest countries when it comes to the intake of alcohol. I think we fall under the 5 highest in the world. It's been known for many years. So now we are in the middle of a pandemic. The inefficiencies of what happened before has never been addressed. Now we are forced to start looking at this. Yes, short term, we have to ban the alcohol. But it's not going to help us. Why was this not addressed many years ago when it became known? These stats is known. It's not a new thing. Violence in our communities is not a new thing. Alcohol misuse and abuse is not a new thing. It's never been addressed properly. The reasons why that's happening. So now we are in a COVID situation, a pandemic, as you correctly said. And now we're bringing in measurements that only controls the emergency, the immediate problem. So again, my question going to be, for how long are we going to do this? Because COVID is not going to go away within the next year or two. So are we going to ban alcohol and cigarettes for a long time? What are we going to do? How are we going to address it?
All right. And now, as the president of SAMA, this is not the first time that you have come and disagreed with how government is handling certain issues. Now, in this case in particular, have you engaged the National Command Coronavirus Council on this matter? And how's your relationship with the health minister about such matters? I mean, one would presume that in a consultative forum, that your voice would also be one of those that are consulted.
Okay, first of all, SAMA is not consulted in the national or provincial command units or forums, that what they are calling them. We are not in there. I'm not sure why the reason is. We have asked how 10 SAMA branches had a meeting a few weeks ago with the MEC where we ask, or they ask, to be part of these command councils. We're not. We're not on provincial, we're not on national. The second thing is, SAMA has asked twice now to get a meeting with the minister, and I know that they are extremely busy, but so far our request has been acknowledged, and that's where it is.